by using the surgical stent. This is one of the our patient, and this is panoramic X-ray which shows before the treatment. It shows the one cuspid tooth which is lying down horizontal impaction. It's very long roots all the way going to the maxillary sinus on the right upper side, and there's still small baby tooth. So we extracted this tooth surgically and placed the bone graft. After the bone graft, we let it heal up for about 6 weeks to 8 weeks. And then it was ready for the implant surgery. We did the 3D X-ray, CBCT, and CAD-CAM digital models. Then we prepared the surgical stent. The surgical stent will help us to diagnose the patient appropriately. How much is the bone, where the implant should go, what should be the size of the implant. We know exactly where how much bone is available. All this is the report of our surgical before the surgery, and we prepare the surgical stent, which shows up in here. This is our surgical stent. This has been cleaned and disinfected with a disinfectant solution. This is our computer guided surgery kit. So I'm going to put this one in patient's mouth. Patient was asked to rinse with the antiseptic solution, and after that we inserted this stent after anesthetizing the patient. Now we do the tissue punch. With the first step is doing the tissue punch. With the tissue punch, we were able to open the tissue of the proper size. And after the tissue punch is done, punch is done, then we are going to do the next step. Which is a surgical drill, which is necessary for the appropriate size. Right now we are putting 4 mm by 11.5 mm implant, so this is a 1.5 mm drill. There's a lot of water is needed for the irrigation. We are using the saline. Osteotomy is almost done now. We are going to be inserting the implant body very soon. This is our implant. Make sure we have appropriate size of the implant. We are just setting our motor for the insertion of the implant. Removed from the packing. Implant is in. Use the driver. Give me this ratchet, please. Bone was little bit softer. We did the under drilling. It's a maxillary arch. So to make sure the implant get good initial stability. It's almost in. Just this yellow spots on the drill shows us how much more it needs to go in. We still have our surgical guide in. We will remove the implant, then we will. It's pretty stable, more than 40 millimeter Newton meter of pressure. And remove this guide. Implant is in, implant body is in. Then we will put the take one X-ray to verify. Okay, let's take the X-ray now.
Okay, you have
Do
the
the X-ray. Do the X-ray. You close your mouth. We'll take one X-ray. Very the insertion of the healing department is in. Implant surgery is all done. There is no bleeding. Looks perfectly fine. So this is a more predictable and precise way of doing implant surgery after we make the surgical plan. This was one of the very challenging case because of the depth of impacted cuspid tooth, but it went very well. And we have a great patient. Thank you for your help. Yeah, bigger one than big. Little pleasure. There it is. You might be able to put it, but still it might need some adjustment. Initially, you can focus more closer.
No bleeding, all tissues healthy on both sides. These all teeth are lingually placed. Our implant is little bit buccally placed as it will require the custom abutment. Otherwise it looks perfectly fine.
Thank you for watching.
Apply moderate pressure with gauze pads or a clean, moist tea bag wrapped in a... Now that your implants have been placed, follow these recommendations to ensure their long-term success. To control minor bleeding, apply moderate pressure with gauze pads or a clean, moist tea bag wrapped in a gauze pad. Avoid chewing until the numbness has worn off completely. If we placed a temporary restoration, avoid chewing for at least 1/2 hour to allow the temporary cement to set. For the first 24 hours or so, drink lots of liquids and eat soft, nutritious foods, chewing on the opposite side of your mouth. As soon as it's comfortable, you can begin to return to your usual diet, but continue to chew on the side opposite of the surgery site. We'll evaluate your situation to determine how soon you can chew on the implant. Also avoid very hot or spicy foods until your gums are healed. If we have recommended a mouth rinse, use it as directed. For the first 14 days, gently wipe the implant site with gauze or a cotton swab. After that, brush the area gently with a soft toothbrush. Don't floss the site for 4 weeks. We will evaluate the healing and adjust your brushing and flossing timetable as necessary. Brush and floss your other teeth normally. If antibiotics or other medicines are prescribed, continue to take them for the indicated length of time, even if all symptoms and signs of infection are gone. To control discomfort, take pain medication before the anesthetic has worn off, or as recommended. It's normal to experience some discomfort for several days after surgery. To keep swelling to a minimum for the first 24 hours, use an ice bag, 20 minutes on and 20 minutes off. To reduce any soreness or swelling after the first 24 hours, apply moist heat. You can further reduce discomfort or swelling by very gently rinsing your mouth 3 times a day and after meals with warm salt water. Use about 1 teaspoon of salt per glass of warm water. If you usually wear a removable denture or partial denture, we will give you specific instructions about wearing it while your implants heal. Limit yourself to calm activities for the first 3 to 5 days to keep your blood pressure stable and reduce bleeding. Don't smoke or use tobacco for at least 24 hours, and avoid tobacco as much as possible for the next several months. Ideally, you should quit altogether because tobacco slows healing and increases the risk that your body will reject the implants. Tobacco is a leading cause of implant failure. Call us right away if you have heavy or increased bleeding, you have pain or swelling that increases or continues beyond 2 or 3 days, or you have a reaction to the medication. Call us if the tops of the implant gradually show through the gums so we can check them. Also call us if you have any questions or concerns.
Yeah, this is blood size. Can you see this one here? You can. Huh?
Any prescription?
You have you just click to number 6. Then it's all entered here. You just enter the size. You put here size. Okay, 4.0, and then you by 0.5.